Hello and welcome to another video. My name is Primrose. I hope you guys are feeling all cosy on this wintry day. I myself am very cold and have a hot water bottle, got my jacket on, I'm filming lots of vids, it's a good day. So what I wanted to talk to you guys about today, or what I wanted to do today, is a little skin vlog. So I bet most of you are wondering, well, what are you talking about? What do you mean skin vlog? Like, I've never done anything like this in the past and I've never hinted at a skin vlog. Yes, it's strange, but it's something that I've wanted to address on my channel and just explain a little bit about my experience and my journey. I actually have plaque psoriasis. You might have noticed, I don't know if you've noticed or not, but basically what it is an overdevelopment of skin cells in a particular area or across the body to the point where it forms plaques on the skin. The area often looks red and can look scaly and also white just from the overproduction of the skin as well, and this is something that will flake off. It can be quite irritating for the person that has it, as in it itches and it's sore. Sometimes it cracks, so there's been times when I've like bashed myself on something and it will just cause the area to bleed and bleed and bleed. It's really not very pleasant. So I'll just show you exactly what I mean. So as you can see, there is a clear discoloration between this part of my skin and the rest of my skin as well. Kind of looks like I've like hurt my elbow or just got elbow pads on or something, and that is on both sides as well. So when did my psoriasis start? Well, my first encounter with psoriasis was probably around the age of 14, 15, 16 when I was doing my GCSEs. Did go to the doctors about it and they did suggest that they thought it was down to stress doing my GCSEs. The place that it was spread was along my back, so it was all over my back. It wasn't in like one massive section, it was all split up into different little sections. I can't really remember too much about that or going to the doctors. I don't remember if I got any medication. I assume I would have, but not too much concern was given. No, like there was no looking into this condition. Everyone just assumed that it would go when I'd finished my GCSEs. I have no previous history of psoriasis or skin conditions in the family, and the psoriasis did eventually disappear. I would say it disappeared within 6 months to a year, and I didn't have any further repercussions or any further problems with my skin after that point. Oh, such a serious vlog today. I'm going to try and make it not so serious, but moving on, that was the first time I'd encountered it. That was the first time that it happened, and I assume once it had gone for good. How very wrong I was. So my second encounter was probably around 2.5 years ago now is when it first started. As you can see, I still suffer with my skin. It was its most prevalent before I went to America, which was last April now. I do vividly remember it having started before then, and at that time it was just on my elbows, and it did start to develop to my back as well, but just in small patches, and it started off of my elbows in small patches too. And then I think as a treatment method for this I was put on Dovabet, but I'm not too sure if that's correct. For some reason it's in my head, so I might have been put on that one. At the start it started to work, and then it got to a point where it stopped working altogether after a flare-up. Even though it would help a little bit as well, it would never completely go, and it would always be there. And again, a trigger for this was suggested that it was stress related, so I just put it down to my job, I put it down to uni, you know, all of those things getting on top of me, and just assume that's what it was, even though I'd try and relax as much as possible. It was a lot of workload to keep on top of. So I'd go to uni 4 or 5 days a week, and then I'd go to work 3 to 4 times a week. And there was times where I'd cross over, so I'd leave uni at 4:30, get to work for 5. It was a lot to take on. I don't know if that was why I had these skin complaints or whether it's other things. So then after my next flare-up, basically the Dove Bet was ineffective. It just wasn't working, and a lot of people had told me to try products with coal tar in. So I thought, okay, what's the worst that can happen? You know, if it helps, great. And I googled it, and you know, so many people were saying this is so effective for psoriasis. So I got product with coal tar in. I can't remember what it was called. It was in a white and green bottle. I thought I'll just try it. If it doesn't work, great. Didn't think anything of it. So I started to use it, and I had never had such sore and cracked skin before. It was so sore with this coal tar product on. Honestly, I would never try it again and never put it on my skin. My skin had just never been as sore, and it was so painful. That definitely didn't help, and I definitely wasn't going to use that again. After going back to the doctor and doing another consult, I was put on Enstella, which is the strongest form of steroid spray that I can have for my skin. It comes out like a gel spray. It's so strange, we call it like Christmas spray on snow because that's what it looks like when it comes out and you rub it in, and that worked amazingly. It was like magic. It cleared up so much. It wouldn't 100% go, but it cleared the skin up so much better than any other product I'd used before, so it was clearly doing its job. And then I'd say a couple of months started to pass, and I'd be putting on the Enstella after a flare-up, and it would reduce it. It would reduce the problem, but it didn't completely go, and it got to the point where I'd start to itch other places because it was like, because that Enstella was blocking the area where I already had the psoriasis, it was finding new places to come up just because it couldn't come up in the same place. So I feel like that kind of encouraged it to spread. So from there, like I say, it did spread to other places. And at that point I was only using it on my elbows and back, to which it did an amazing job. But unfortunately it did start to spread. So some of the worst patches it spread was to my hips. They're really, 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 really hard places to get rid of it. It doesn't shift. No matter how much Enstella I use, it does not go. It would not go through that skin. And then I'd say within the last 6 months it developed its worst. It went behind my knees, it went on my ears, it went on all over my abdomen. I'd never ever had psoriasis over my abdomen, under my boobs. It had never happened before until recently. And on my butt. It went on my butt too. Fantastic. You know, the more I used the Enstella, I felt like the more it would spread to other areas of my body, and it was just going in a horrible circle. The Enstella wasn't working, it wasn't cleaning the skin up at all at this point. And you know, by this point I'd almost given up as well with all these bloody treatments. You know, I felt like there wasn't anything past using the Enstella that could help, because they'd already told me this was the highest form of steroids that I could be on. I just didn't know what to do at that point, so I went back to the doctor, and bearing in mind I couldn't see my regular GP because he'd been removed from the surgery due to misconduct. Fantastic. I saw different locums and I said, look, I want some further treatment. I've been on this medication for a year, 2 years now, and if anything, it worked at the start, but it's made my skin so much worse since. And I've had no clear success that it's working because it's coming up in all these other places now. The doctor I saw at the time seemed very reluctant to give any advice or any further treatments or anything that I could do. So at that point I requested to see a specialist, and on the NHS it would have been a 6-month wait to see a specialist about my skin, a dermatologist. I just didn't want to do that. I already felt like I'd waited and gone through so much at this point with my skin. I needed something to be done. So I asked if it was a possibility to have a referral to a private dermatologist, and that got sorted within less than a month. It was ridiculous how fast they came through and got sorted and got an appointment. So obviously for that I had to pay, but that is something that, you know, I was willing to do because I just wanted this sorted at this point. I felt like I'd gone, like I say, through so much with my skin already. I just wanted to be sorted, cleared up, and just fixed at this point because I was sick of it, and I was sick of seeing it, and I just didn't want to carry on with the way my skin was. anymore. I wanted to get help for it and I wanted it to be sorted because there was no reason why I should be getting this. So as part of the specialist consultation, he examined me and discussed the medication that I was on at the moment. At this consultation I was given other medication to try. This is one that he gave me and it's a Lido. I think this is the one for my ears. I'm not currently using this one at the moment. Now with this, it's used for patients that have eczema but will work for patients with psoriasis. The reason I stopped this one was because it did give me a burning sensation on my ears, which he did say was normal, so that's okay, but I felt like even though I was using this, it didn't actually do anything for my skin or psoriasis, so this is one that I stopped using. Other medications he gave me were balneum cream. So this is a big old tub of this one, and what this is used for is to basically stop any itching, just so you don't scratch at the area and obviously make things worse. So this is just to stop itching. Again, even though my skin was itchy and I applied this, I feel like it didn't actually do anything for me. It didn't really stop the itching, it didn't really stop the soreness or the inflammation, it didn't really seem to calm it down. So again, this one, the balneum cream or balneum plus cream, it didn't really do anything. I feel like, for me personally, I just didn't have any success with this. So alongside the medications that he'd already given me, he also suggested that I get a Philips blue light. Now this kind of replicates light therapy in a way that you can use it at home. I did look into this and it was going to cost me over £200 just for one of these, but to be honest, it was something that I couldn't really afford to do, especially at that time and especially now. Like, I literally could not afford to get that product. He did say that if there was no success, you could always return the item. It was just not practical cost-wise for me to get that product and that item. Even if it would have benefited the skin, it was just something that I couldn't do. So following this, he did mention to me UVB light therapy. Now this is something that I had researched and was interested in as a way to help my skin, because I was kind of looking at it as a quick fix. I understand now that, you know, it's definitely not, but this is my mindset at the time. If I wanted to do that privately in the clinic, it would be £30 a treatment, and this would be for up to 30 treatments, which again would be way more than I could afford. So what we asked was, can we be referred back to the NHS for the light therapy and do it that way? So he said that's fine. So I went back to the NHS, back to my GP, back to see the doctor after receiving my consultation letter from the specialist, and basically it was a different doctor, sorry, I saw this time. Again, just because my current GP practice is full of locums, and I don't think we've got any permanent doctors yet. I went and I saw a lovely doctor, explained the situation, explained that I'd paid to go to a specialist because of obviously the waiting list would be so long. I wanted to get my skin sorted, obviously explained about the Enstellar not working, and she said she was disgusted that I have been on this Enstellar for so long without any further treatment, without anybody looking into, you know, further treatment. So what she did was she put an urgent request in to the hospital, just so I can get this sorted and can see, you know, a different professional and hopefully get sorted for light therapy, because, you know, that's kind of what we were sort of aiming for here at this point. Yeah, she put her urgent referral in for me. She was absolutely lovely. She could see how much that it was affecting me and that I just didn't want to be like this anymore. And, you know, I think as a woman she could really understand as well. I just wanted to have skin that wasn't affected by a condition. You know, there was no reason for it to be there on my skin. You know, it wasn't hereditary. I just wanted it gone, basically, and I just didn't want to be left and felt like I was being passed around and like nothing was being done, because that's kind of how I'd felt up until this point. So then my initial hospital appointment came through. This was for the start of December, but then it actually got brought forward to the start of November, which was really good, and I was surprised how quick they could get me in, because this was only a month or so after I had my consultation with her. Admittedly, when I was going, I didn't know what it was for. I didn't know if I was going to be expected to do the light therapy there and then. I didn't really know what it was for. It was just a consultation at this hospital, I guess, to talk about my skin some more, you know, because everybody loves talking about my skin so much and not doing anything about it. I saw another nurse. She was a dermatology specialist. I explained about my skin. I explained about the history of my skin, the medication that I was on. She examined me. She examined where it was the worst. You know, I explained how long I'd had it for, and that I just, you know, I was at the point where I wanted it gone now. And then I also mentioned to her that even though it had previously been thought of as a stress thing, I've recently noticed that it's related to my hormones, because every time that I'm about to come on my period, or a week before, it flares up and gets worse. And then afterwards, it goes as calm as it's ever been, you know. So it's almost as if when my hormones fluctuate at that point, it gets really bad, and then as they come down, it eases off again. And this is something that I just picked up on recently as well myself. Whether that's a recent development or whether it's always been like that, I don't know. I would have noticed hopefully before if it had always been like this. She spoke to a doctor about this and said that this could well be a possibility. So, you know, they can't rule it out. It could be a possibility. So she advised me to look into birth control treatments to see if, you know, being on some form of contraception and controlling my hormones is going to make a difference or not. Which is something that I still have to do. But so we talked about the light therapy. After a while, I didn't think we was actually going to get to it. At one point I was like, is this all the consultation is? Do I ask for to ask about the light therapy? But she mentioned it to me. She said, obviously, have I heard of it? So I said yes. And she said, well, obviously it is an option if you're interested. I said, you know, look, I'm definitely interested because I just want it gone at this point. So we discussed the therapy. She went through all the side effects and all that jargon that they have to, and said, you know, if you're up for it, we can sign a consent form and I can get you an appointment. So I said that would be great. I signed a consent form there and then, and then it was just a waiting game for my appointment to come through. Back onto that appointment, I also got lots of different medications to try as well, because she said we don't know how long the appointment's going to take to come through. It might be 6 weeks, it might be 6 months. You just don't know, depending on what the list is like and how many people are undergoing this treatment. So I said that's fair enough, you know, any time, any day I can do it at this point in my time, at this point in my life. I don't have a job, I don't have commitments, you know, just tell me when, where, I'll be there. She was like, that's great. And then she said, in the meantime, obviously try these topical treatments that are really going to help. So I will talk you through my medication collection. This one is the Enstellar. This is my every single day. It is a cutaneous foam, cutaneous meaning on the skin. And I use this before I go to bed, so I spray it on. This is my steroid cream spray. This is the bad boy. This is the one I spray before bed. Yeah, this is the hardcore one. It is really good, and recently I've noticed it's been working a lot better. I have to use this every day until I see an improvement, and then take it down to once every 2 days, then once every 3 days. If it flares back up again, I need to take it straight back up to every day and then try and wean myself off of this one. So this is the bad boy. So that was my product I've been using for must be 2 years now. I have got this one. I don't believe I got this one from the hospital. I think I got this from the doctor I saw before the hospital, my general GP, but I can't actually remember. So this one is Hydromol. It's an ointment, so I'll show you what it looks like inside. So it looks like this. It's just a big old block of ointment, basically. This one is basically just a big ass moisturizer. I put this on in the mornings and after showers, at lunch, twice a day if I need to, usually just once a day though if I need to. It's really, really good at hydrating the skin. I really love this moisturising product. Honestly, it's really good. It's like a non-steroid version of the Enstellar in terms of keeping the skin hydrated, moisturised and just full of moisture. This is a big ass moisturiser and I love it. You're a bit sad when you have to say that you love moisturising products and prescribed medications. Yay! Okay, so this is one that I did get from the hospital. This one is called Hydromol. Now what this one is for is it's a bath and shower emollient, is that how you say it? Basically this one replaces all the nice bubble baths, all the nice shower gels, all the things that make you smell nice. You have to use this one instead. Yay! So yeah, the nurse told me that, you know, there's a chemical in the shower gels and bath products that make them foam up, and that can often set off psoriasis. So I'm using the Hydromol now. It's a really, really greasy, runny product. So what I usually do is put it straight onto my squeegee, put it under the water, give it a good old squeeze and mix around till it gets a little bit of a lather, and then I scrub my skin. Honestly, I scrub it all over my psoriasis, everywhere. This doesn't smell the best. It kind of smells a little bit like a wet dog, a little bit like grubby, but if it does the job, it does the jobs. And yeah, this seems to be a good product. No, don't worry, there's more. So I have 2 more ointments here. So we've got Clobovate. Now this one is my new ear product. So instead of using the Leodel, I think it's called, the dermatologist provided me, I'm now on this one. This is once a day on my ears. Again, I usually do all my creaming up at night and then just sit there. And then I have this one. This one is Diprosalic. Now this is one that I use for the tops of my thighs / hips. The psoriasis there, because as mentioned, it is to get rid of. Honestly, the Enstellar barely made any difference, if any. So this is a little bit hardier, you know, it's got salicylic acid, so it is a little bit hardier just to be able to break down that skin, and because it's a little bit tougher on the hips as well, I'm absolutely fine to use this. So again, this is once a day with this one on that part of my body. Okay, so I think we're actually all up to date with my skin stuff. Hope you liked the video. As boring and medical as it is, I really hope this video actually helps somebody, lets you know that you're not alone. I actually want to do like a 2.0 of this video, just to talk about the effects of skin conditions and psoriasis on mental health as well. I just don't want this one to be too wordy, considering it's like backstory, leading up to all this stuff, current medication. So yeah, just to let you guys know as well, I am a little bit behind on filming these videos, so I have actually started light therapy. I have got, obviously I want to do the mental health video, and then I did a video on is light therapy right for me. So if you're considering light therapy, please do go and have a look at that video. It will be going up after this one, so make sure you're subscribed and you clicking that little bell just so you get notified when I am uploading. And then I'm also doing light therapy vlogs as well for you guys. So again, please do keep an eye out for those. Follow my journey and my story, and hopefully your girl is going to be cured, but we'll see about that one. So I'm just going to say thank you so much for watching. Don't want to drag this out any more than I have. Please post all your comments, questions, anything down below. I'm not a medical professional, but I will try and help you when I can. If you are concerned that you have psoriasis or any form of skin condition, please do go see your GP or doctor or clinician or whoever you talk to about that. Please do give me a like on Instagram at PrimroseDoe, and I will look forward to seeing you in the next video. Again, I really hope you enjoyed, and I will see you then. Bye guys!